My name is Amy Sauls. I'm the Director of Pharmacy and Professional Services here at Campus Health. And I've been here almost 10 years now. Here at Campus Health, I'm co-chair of the medication management team. And it's been about 6 years ago or so now, we put into place a stimulant medication policy. So we require our students to provide documentation of testing before we'll prescribe amphetamines or medications for ADHD. We have our students read a contract and sign it that just reinforces that it's a criminal offense and a violation of the honor code to share these drugs, to give them to someone for whom they're not prescribed. So every student who obtains those medications from either our pharmacies or if it's prescribed by one of our providers, they have to sign that contract. So those are things we've put into place because certainly, we hear of students going, to places where they're readily exchanged and available, even for those who are not prescribed the medication. But these are, there are many differences. So first of all, these are Schedule II controlled substances. So they are highly regulated by the federal government, by the Drug Enforcement Agency, and it is a criminal offense to have it, take it, and without a prescription. So that's the first difference between someone who has a prescription for it and someone who does not. Someone who does not is breaking a law and possibly committing a felony. So there you go. There are medical effects to this. So for instance, we will do a history with a patient to make sure there are no cardiovascular risk factors. These medications cause elevated blood pressure, arrhythmias, weight changes. So there are medical effects to these, and that's why they have to be prescribed by a provider because, that's I always tell people if they're don't share it with your friend because you don't know if your friend has an underlying heart condition and this could possibly send them into a fatal heart arrhythmia. What the literature will tell you is that when they look at the grade differences between people who take them non-medically, meaning that they don't have a prescription for it, they're getting it from someone else, and those who do not take them non-medically, there are no differences in the grades in those folks. For someone who has a legitimate diagnosis of ADHD, yes, it should make a difference because it's helping them with a legitimate medical condition.